So Dr. Itengre, I know that you have a new clinic coming online and construction is nearly complete. And I know you've got some video for us on that. But could you tell us about the clinic?
Yeah, I have the video. And the clinics comes as something very important for Arena here. And because it will help to really implement the holistic care for fistula patients in Burkina Faso. And our understanding is up to now, there is not really a dedicated center for obstetric fistula patient in Burkina Faso. And we want to innovate with our clinic. So we are really excited because construction is already done and we are just waiting for medical equipment so that we can start our activities. So we have capacity to offer surgical treatment and space to have some patient there and the same place to offer social integration services and include even pelvic floor education for the women that we need. So that is something really exciting. That's come, of course, with challenges because we need to recruit our own staff. We need to train them so that they can really offer the high quality care for these women. And one thing important is we are expecting to be able to give medical staff training, like train other doctors to do fistula surgery and train other nurses and how to take care of the patient after surgery. Of course, our vision with the clinic would be to be able to get other doctors trained so that they can take care of simple cases in other public health centers and then refer to us the very complex cases at Arena Health Centers. And as I said, will be a center for holistic care. So we will be able to offer other maternal health care services too. So we are really excited with the project of the clinic.
I want to acknowledge that the construction of the clinic was funded by an organization called SOHO, who we've been in communication with as well. And we're both very dedicated to supporting you. So WFF's funding for all of your general operating programming, as well as running the Arena organization that has been done at partnership with other clinics, is now all going to be funded through happening at the clinic. All the programming will happen at the clinic. So even though the surgeries are not starting this year, the space is pretty much done the construction is complete, correct?
Yes, construction is done. And while we are waiting to open for surgery, we will be able to use the facility for education and social integration service.
So in addition to knowing about your immediate plans for the next 3 years, we're also interested in hearing about your hopes and your aspirations for your organization, like further down the road. So like 5 years from now, where do you see your organization? What are your hopes for what you'd like to achieve and where you'd like to go?
Our aspiration is really to see Arena as a champion and delivering like full maternal health care services, going behind just the fistula patient, being able to deliver full maternal health care services. This is our goal, and yeah, we will be working toward that. Just wanted to renew our gratitude to WFF and all the donors to WFF. I want to say on behalf of Arena that WFF has been a very important partner, more than a partner, just like a mentor, because we have been mentored to develop our activity, and we are really thankful to that. It is not really easy to develop this kind of program in countries like Burkina Faso. But we have got advices, mentorship from WFF, mainly from Soja and Dr. Chris, especially for me. And that has been really helpful. So, and I want to let the supporters know that it's not just about doing fistula surgery, but it's beyond that. Life are being changed here. We have seen the impact of our activities here in Burkina Faso. We have been seeing women who lost everything, and 3 months after the surgery, when they come back, they are able to tell us that they have been able to renew their life. Some of them have gone back to form their family, to develop small activities that with the empowerment we give them just after the surgery. So we are really thankful for all what you are doing here. It is really changes life, and I just want to say this is a real transformation to see how this woman with a broken life changes completely to be a functioning part of their community and the development of the society. So we get testimony from that, and we always share with them that, look, we get support from people from outside. And they say, okay, we want you to tell them really thank you. And as we say here, they will just say, tell them we will be praying for them, that God will bless them because they have changed our life. So we want to renew our gratitude. Thank you very much.